Thank you, everyone, for listening. This is Prairie Doc Radio. We are a call-in show with Dr. Rick Holm, who's an internist at the Avera Medical Clinic in Brookings. And we are here to talk about medical issues and answer your questions if you'd like to call us at 692-1430. Good morning, Rick.
Good morning. You know, Joni, you don't look a day over 14.
Thank you. Would you like to introduce our guest?
We have the medical clinical director of the Avera Medical Group Brookings, Mr. Patrick Siegling, who has replaced Pat Mary, and then Patrick Woligoski before. So there's a Patrick in there. I always think of I think that you're a Pat plus a Rick. So you can, you and I are similar in that way,
That's exactly right. That's a good way to put it.
So, welcome. You've now been in Brookings for how long, Patrick?
Just about a month.
And you hail from where originally?
I hail piece of it, but one of the big things would be, the digitization of everything. Everything's going on computers, medical records, everything, our day-to-day basis is now either done on our phones or our computers, and that is a huge shift in the way that medical care is delivered, and I think ultimately that's going to be it's certainly going to be a positive thing, but our journey as we get there is rocky at times, but we're getting there. I also think in healthcare you're seeing patients and healthcare consumers become a lot more empowered, where they want to take control of their own healthcare. They want information. They want to seek out second opinions. They want all the information that they can get their hands on. And that's really been a shift of saying, how do you meet consumers where they're at? How do you provide the care that they want when they want it? How do you give them the information that they want? And I think that has been the big shift. And thirdly, the big things that we see is dealing with all of the regulations that come with healthcare reform and the shifts that are happening there. We could dedicate hours on the radio to talking about all the changes that need to take place with healthcare reform, and we're in the midst of those changes now.
My thought would be that if I were the government and I was looking at people receiving care and everything was third-party payer, everything was coming from the government itself paying for it, or all these other sources, and the patient who's going to want to get as much as they can get, because that's not human nature, and of course you're going to want the most you can get, then you're going to need to regulate, because the doctors are going to try to get the most that they can make, the patient's going to get the most care that they can make, third-party payers are out there, and so somebody needs to regulate and make sure that quality is being provided, and not somebody making off with a bunch of dough for very little. But if it were the old way, where it was between the doctor and the patient, there were not third-party payers out here, and there weren't all these other things, and the patient had their choices, they picked what they got, they had reasonable prices on drugs, reasonable prices on things, and the payer was the patient. And they had, then you wouldn't have to have so much regulation. The regulation is coming as a result of the third party. and all of the human nature that comes in between. So I am eager to let the patient have power and let the people who are dealing with patient care be more the patient and the doctor or the healthcare system than it be all these other parties in between. And as you say, that's the trend now, is that it's going back to empower the patient. I think that's a great thing. Anything I can do to enhance that, I'm going to do that.
And I think you see a lot of that with the growth and popularity of the high deductible health plans, where
have you respond to this is that means that the cardiac surgeon gets paid from the third party payer. You know, the guy who does the big procedures, you know, who has who generally is the highest paid physician, they get the money. The person who's out there sometimes sweating bullets, making on the very front line in the trenches. They're going to have to they're the ones who get paid depending upon the patient's choice. And so I'm all for what you're saying. The highly deductible makes sense to me, but where if the system is going to try to find a way to control costs, it's not going to be squeezing the small dollar guy on the front line. It's going to be, I think, by saying, no, we won't pay for all that chemotherapy because this chemotherapy has not been proven. No, we won't pay for the whole 9 yards for the deluxe super cardiac bypass from this group. We might want to go with this other group. And in my sense, that's where the money is. Now, I have your response, but we got to go to break pretty soon.
Sounds good. Looking forward to it.
Yeah.
Okay, we'll take our first break. I'll remind you that this is Prairie Doc Radio. We'd like your calls at 692-1430, and we'll be right back.
You see, that's a problem.
Today is Patrick Siegling, who's the clinic manager at the Avera Brookings Medical Clinic. So we were just summarize your question, Rick, in case people are just arriving.
Well, I was just philosophizing about the fact that deductible method does not necessarily save as much money as we think it will. It doesn't push on the high-end people who are overcharging. It squeezes the small guy, the people we need a whole lot more of, which is the person who's dealing one-on-one daily with the patient and is the primary care provider and cares about that person as should be their overseer. And you're the guy who will be helping coordinate that charge. So
comments?
Yeah, so I think a couple things, and the first thing that I'd like to highlight is one of the really innovative things that we're doing here at Avera and Brookings is, and I think that they'll be on a future radio program, is the coordinated care model.
Yes, next week.
And so I think that what that does is that goes to shift the old way of medicine and fee-for-service of saying, doing as much as you can. I think that that's the old way. We're in the new model, and something we're working with coordinated care here in Brookings is where around the patient with the physicians, the nurses, the social workers to make sure that that patient is well taken care of in all aspects of their health. reward people in this system for keeping their pay when we can. And I think that when they do need hospitalization and do need that more specialized care, that we can deliver that is the best that we can.
I love this. I mean, people don't realize the value of this. I mean, Joni's the one who's said to me, "My gosh, Rick, have you utilized these people yet?" I hadn't indeed, and she'd been doing this. Tell me your take on it, Joni.
Well, we need to save for next week since they're coming, but I had a personal relationship with Erin, whose last name I can't remember right now, because she worked for CASA, and so I knew when she started working as our social worker that we had a winner.
What is CASA?
CASA is court-appointed special agents, or advocacy, and it's she was a social worker that helped with children who were out of their homes in different kinds of placements, and so she coordinated their care. But she has since moved to the Vera Brookings Medical Clinic, and she is a fantastic person, and we'll learn more about it next week. But I like the fact that it enhances the total care of the patient versus the segmented care that you're talking about, Rick, where someone runs and gets an ultrasound or goes and gets a MRI, and this brings it down to let's look at all of the needs.
Well, you talk about a diabetic. You're not going to win on controlling their blood sugar when their life is a mess. They can't. Their relationship is falling apart. They're going to the bar because they're all they don't have support from their partner, or they eat the worst food in the world because they don't know how to cook because the cook that they had is gone now, or whatever it might be. But I mean, a person's life and their social situation really means a lot more to a person, and you're going to affect better health care for that person when you have a handle on that, or you're able to help them with that.
Yep, and I think that a lot of the trends we're seeing, I think what makes the future really bright for healthcare is shifting from a model that rewards people for doing things to a model that rewards people for keeping patients healthy.
Right, and I really, that is bingo,
Perfect.
right on the mark.
Right.
It's just that how can you pay them for that? I mean, that's it.
Well, that's his.
I mean, his job.
Right.
But
right.
I concern myself. I'm concerned about the future of primary care, medical care, physicians, and nurse practitioners, PAs, making sure that they're doing the very best care, and that the trends are to pay them if they follow protocols, many of which have been coordinated by pharma and doctors who are paid by pharma, and so I mean protocols. We've got to be very, and this is I'm giving you shots of the things that are on the top of my mind. Protocols that we need to push primary care providers into to define quality should not be add another drug. And the other is that the protocols should be, we shouldn't just necessarily use protocols as a measurement of quality.
Mm-hmm. And I completely agree. I think one of the biggest things that still need to be worked out is how do you define high quality care. I think all of us have an idea in our heads of what high quality care is, but we need to get to a point where we can all agree on what those quality measures are and how we measure our providers against them.
What do you, Johnny?
We need to take a break, and then I would like to ask Patrick about things he'd like to talk about with the clinic. What are you seeing? What would you like to talk to the public about? But Bob, can we remind our viewers, our listeners, that this is KBRK 1430. You can call us at 692-1430, and we'll be right back. Rick, you were going to start with another subject with our guest.
Last night we were together recruiting a new physician to town, working our best to try to recruit a physician to town. And one of the things that we always need to do when we're recruiting is to, and probably our best recruiting tool is quality of this community and this place in the country. I think there are people who want to go to San Francisco, or they want to live in, Miami, or they want to live in, New York City for various reasons, and so on and so forth. But I think there's some things about our community that are just really great recruiting tools, and I'd throw it at you because you just got recruited here. So what's your take on this community?
I did. Well, coming from, I lived in Redfield, the town of about 2,500 people, and then I've lived in Minneapolis with about 2 million, and I've lived in every place in between. And I can honestly say that the decision to come to Brookings was an very easy one. The best way I would like to describe it is that it's got all the big town amenities, but still that small town feel. It's anything that you need in town, there's a great chance that you can find it right here in town. If you want to go out to a great restaurant, have a great meal with your family, you have that options. But at the same time, when you're walking down Main Street or into the hardware store, there's a great chance that you're going to run into somebody that you know and you're able to talk to them, which was a huge draw. I think. Again, as an outsider coming to town, just the amount of economic growth that's happening in Brookings right now is really, I would say, unparalleled across the state. You look at all the different manufacturers in town that are adding jobs. The incredible successes that the schools have had in town. It's really great. I think that the future is very bright in Brookings, and I think you can see that all around town. And then just for me personally, the opportunities for young families. You look at the school system, you look at the children's museum, you look at the bike paths. All of those just make Brookings a great place for young families, and that was part of the draw.
And I'd like to think that our healthcare system is a draw in the town. We've got an excellent couple of clinics. Our hospital is superb. So people can stay home for their health care unless they are referred out because of a special need, but otherwise we've got a nice space for them.
I keep thinking about when I was in Atlanta and somebody got sick in inner Atlanta or peripheral Atlanta, they'd hop in a ambulance and they'll get to that place and they'll get to the emergency room and they'll get to the bypass surgery room. And about the same time we can get him from here to the bypass surgery room. I mean, we have quick access. The internet the interstate is not that far away from the most critical kind of surgical emergency space that you can get in the country. And so, maybe not as very fast, but pretty darn close. Mm-hmm.
And you would see that. So even at the clinic, we receive feedback from patients quarterly and things that they say in anonymous surveys about the clinic. And one of the things that I see over and over is how important it is to provide good health care close to home, and how important that is to the folks in this area. And at Avera Brookings, that's one of the things we pride ourselves on. We're going to do our best to take care of you here locally, even with the outreach physicians for oncology coming up from Sioux Falls here is a great service that we like to provide here. And I think that that's one of the things we pride ourselves on, is being able to provide that great health care close to home.
I'm not sure that the clinic or the hospital ever probably promote or toot their own horn, I suppose, on all those great things. But to be able to have chemotherapy at the Brookings Clinic, once you've set up with your oncologist, but to not drive 2 hours to get that infusion, that's big. And we have that available. And so if you don't know about that, and of course dialysis in our community as well. So there are lots of things that can happen in Brookings and don't have to take place in the bigger communities.
Yep.
We fought hard to get that dialysis. I want you to know there was a long struggle for that.
We have a great mammogram machine at our clinic.
And you know what? Thank you to Dave Johnson. I should shout out to the hospital administrator for the Brookings Hospital. That's what it was named those many years ago, and he fought hard. Scotty Roberts fought hard for the right thing too, and I have to say that it was probably Scotty Roberts who got it more than anything else. So anyway, just the history of this community and the healthcare that's gone on. I was thinking about Scotty Roberts the other day, and
Many of our listeners remember Scotty.
Scotty and Bruce
an
Lushbaugh.
internist.
Bruce is alive. Scotty is no longer alive, but Bruce is alive. And I mean, I think about some of the people, you know, the Dick Wakes in the world. Those are doctors that were here before. That you know, really, their heart was for the right thing, do the right thing, help our community do the right thing. And you know, you get enough like-minded people like that, and the results resound years later, and they're still resounding. You know what I mean? Those little things. So, what other things do you think people need to know about our clinic and about your job that we should highlight here?
Sure. I think the one great thing is anybody who's driven on 22nd Avenue has likely seen the construction that's taking place at the hospital and right next door to the clinic. And I'd just like to say that the partnership between Avera Brookings and Brookings Health System is incredibly strong. And you'll see that with the new construction, the new focus on putting the patient first. Across the board, I think that again, the future of the two organizations partnering together is going to meet and even exceed, I would say, the expectations of the Brookings residents as far as healthcare goes.
So you know, the clinic. You know, the years ago, the people always thought that either the hospital was owned by the clinic or the clinic was owned by the hospital, and of course, they were not, never, and they still aren't. But they have joined in many ways. In a part of it has to do with billing systems, but how would you put the fact that we work together?
Sure. So I would, without getting into the legalese of joint ventures and that sort of thing, it's a very strong partnership. We are linked as one with the clinic and Brookings Health System and the hospital, and I think that again the whole purpose there is to put patients first, do what's best for the patients, and that's really the root of that partnership to make sure we can provide great care across the board.
The hospital is building a clinic office space that will be in the front of the hospital, and Avera is going to be remodeling the clinic. Explain a little bit of that.
Sure. So the hospital is building a new medical office building, which some of our physicians will be moving over there. And then shortly after that, we're currently under deep analysis to determine what the needs are of the clinic. So we know that the building is somewhat dated. We know that it needs to be updated in many ways, and we're looking at that now, figuring out what's the best way that we can meet the needs of the patients. And hopefully sometime this spring or summer we'll have a firm idea of what we'll be doing, and we can let the listeners know exactly what our plans are.
Right.
Certainly, as longtime residents, Rick and I have heard concerns about the aesthetics of the clinic, and I like to think that the care has maintained a high level. But there is something to that when you go into the clinic, it feels dated, and maybe the
1960.
carpet isn't perfectly as clean as you'd like to see. So there is a nice feeling, I think, on the staff's part that this is an up-and-coming aspect. And so those of you listening who have thought that about the clinic, hang on. Don't give up on us. We're getting there, and we're going to maintain our good care.
Yes, change is coming. The care is and always has been top-notch. The people there, it's just a feeling of admiration from me for the work that the physicians and the nurses and everybody is doing in the clinic. And so now the biggest question that I'm asking myself is how can we update the facilities to reflect the great care that's being given there.
Right. So let's talk a little bit about recruitment, Patrick. What do you see is coming as far as recruitment in new physicians in the coming years?
Sure. So we're always recruiting. Again, I like to say that we have a good problem in the clinic, and that we're running out of space. We're growing. We're adding new physicians. We're always looking to add to the specialties that we have, which include OB, ortho, and several other specialties right now that we're actively recruiting for.
And we saw a new OBGYN potential person last night.
Yes.
And we've got family physician person coming.
And an internist coming.
And an internist that we have nailed. We have for sure what coming.
Yep, and so we have a new internal medicine physician joining us this fall, and then
Dr.
next.
Evans, her dad is the golf pro at the country
And her
club.
mom is in town
Her
as
mom
well.
is in town.
Bev
Yep.
Ted.
Okay.
And-
Shout out.
Yep, and then next fall we'll be adding a new family medicine physician.
That's great.
So those are the for sure's that we have, and we're recruiting. We saw a new OBGYN last night. Her and her husband are from the south of Nebraska area, right?
Yep, that's correct. Currently living in Nebraska, but from South Dakota originally. So they're like me, looking forward to coming home.
You think we have a pretty good chance of that person?
I hope so. I hope so.
I think so.
You know what? I think I would speak for many people in town. It sure would be nice to have a dermatologist. Anybody interested there?
Kind of hard to get that all by themselves. I mean,
Oh, I think they'd be plenty busy.
Oh yeah, but and of course, anyway, there's a lot of potential specialists that we could have. There's
And
no
we do
question.
have specialists that come in from Sioux Falls, so that's terrific, that people's needs can be met.
Right, and we have internists. I'm happy to say that I was the first internist in our state, or in our city, board certified. But Scotty Roberts was here, and he was a self-made internist, as we used to say. A lot of the doctors, when I moved into town, had done an internship and then been practicing since. In fact, Dr. Henry had done a one-year internship and became this surgeon that was well-known all around.
And well-respected.
And very well-respected because he was so good.
And nowadays, there's another 5 years they'd
Yeah.
have of that training. So we
It's
have to
so
send a
different.
shout out to Dr. Johnson and Dr. Wee for their great care they
Oh,
give.
the
We
two wonderful
certainly are
surgeons that
very
we have.
happy with the surgical skills that we have in town.
Right. So, in summary, I mean, I know you have a list of things that you want to go down that list. Is there anything in particular that we want to make sure that we tell people about?
Well, I think we just covered most of it. I think the biggest thing to say is that I truly don't think ever in my life I've come across a more selfless group of people than we have at Avera Brookings. On Monday morning, I was meeting with a physician who spent all Sunday working in the ER to save the lives of patients that come through those doors, and quickly had to turn around and work Monday morning and see a full clinic. And I think that when I see that, it fills me up in seeing the work that goes on in the Brookings Clinic. I mean, you see all the way from in this latest blizzard, you see our nurses walking patients out to their cars. You see our referral specialists fighting with insurance companies to get MRIs approved, and you just see all of that. And I truly could say that I could not be in a more rewarding career at a more fantastic place than Avera Brookings.
And I'll echo what an honor it is to work with these people. No question about it. Welcome on board, Patrick.
Yes, we're very
so
happy
glad
to have you.
Yes.
So
Thank you.
thank you to our listeners, and we hope that if you have medical needs, you'll give the Avera Medical Clinic a call. We'll be happy to help you in whatever way we can. Our website gives our hours and information about our providers, so you can always look at the Avera Clinic website.
And you can get into the patient portal and look up at your own records and the progress notes of the doctors and the whole 9 yards. We like it. Thank you very much, Patrick, Joni, Bob, and stay healthy out there.
The program tomorrow night.
The program tomorrow night is patient elder abuse. It's going to be fabulous. We've got
Thank you, Bob.
wonderful guests, and we've been interacting with the Chief Justice and the and 3 justices. I've been internet